Hello everybody, welcome to Support Talk Thursdays with me. I'm Cecilia. Today the topic is going to be on depression. What is depression, the causes of it, the treatments of it. I'll give you a little bit of tips on how to deal with it. So yeah, let's jump right into it. Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interferes with a person's everyday activities. Um, if you have the feeling that you want to sleep all the time, you want to stay in bed, you don't want to do anything, um, you might have a form of depression. It's fairly common for people to get depression. Some people don't even know they have depression, they just wonder why they feel this way. Some people don't want to believe they have depression, so there is also if you're not sure if you have depression or anything, there is if you go to Google and type in depression, there is like a test or a questionnaire you can fill out, and it'll tell you if you have the symptoms of depression or whatever. So if you think you have depression, go to Google, type in depression, check it out, do the test, and if it says that you possibly do, then you can try to find trying to find tricks or whatever to deal with it on your own, or you can call a mental health provider, get into therapy, get in to see a psychiatrist, and everything else, and see what kind of depression you are. If you're moderate, major, whatever, they'll be able to tell you. The Center for Disease Control and Prevention, the CDC, estimates that 8.1% of Americans aged 20 and over had depression in any given 2-week period from 2013 to 2016. People experience depression in different ways. Everybody's different. The way you deal with depression might not be the way I deal with depression or experience depression. So everybody experiences it different. It may, like I said, it may interfere with your daily work, resulting in lost time or lower production, and can also influence relationships and some chronic health conditions. Perfect example, I used to work at Dollar General right up from my house, and my depression had gotten so bad in January that I actually had to quit my job because I just couldn't go in, and I didn't have the energy or the stamina to, go to work and keep up with the pace and everything. So I ended up having to quit my job. So that's a perfect example. I am planning on, hopefully, maybe, when I get feeling better and get it under control and everything, I am planning on hopefully returning to work. I don't know if that's going to be an option or not, but I'm planning on it. That's my goal. If you have any of these conditions that I'm getting ready to list off, they can get worse due to depression, and this includes arthritis, asthma, cardiovascular disease, cancer, diabetes, obesity. I don't know about the other ones, but I understand obesity because when I'm really severely depressed, I want to eat all the time. And it's not healthy food, it's more like junk food, chips, cookies, chocolate, candy. It's not good food. So, obesity, I understand. The other ones, I'm not 100% sure how they get worse or what causes them. My only thought is it's caused from you not taking care of yourself because of the depression. So, yeah, if you have any of them conditions and you are depressed, watch it, keep up with it, because it can get worse due to your depression. Also, it's important to realize that feeling down at times is a normal part of life. Sad and upsetting events happen to everyone. But if you're feeling down and hopeless or hopeless on a regular basis, you could be dealing with depression. If you feel down because you've lost a loved one, if you feel down because you've lost a pet, that don't necessarily mean you have depression. If you feel down and hopeless all the time, like nothing you do can make you happy or anything, that's when you might have a form of depression. Um, those who seek treatment often see improvements in symptoms in just a few weeks. I've been seeing a therapist now going on, I think, month and a half, and it helps me. It helps having somebody to talk to and everything else. Um, which is why I'm doing Support Talk Thursdays. That way you can comment below if you have any questions. If you need any advice, if you just need a support system, I'm here. Okay. Now we're going to get into the symptoms of depression. Depression can be more than a constant state of sadness or feeling blue. Okay? Major depression can cause a variety of symptoms. Some affect your mood and others affect your body. Symptoms may also be ongoing or come and go. Some symptoms can actually stay. Some symptoms come on all of a sudden and then go away. It all depends on the person. Just like I said, what I go through don't necessarily mean that's what you're going to go through. The symptoms of depression can be experienced differently among men, women, and children. Differently. Sorry about that. So yeah, the symptoms of depression can be experienced differently among men, women, and children. Men may experience symptoms related to their mood, such as anger, aggressiveness, irritability, anxiousness. Okay. Men can also experience emotional well-being, such as feeling empty, sad, hopeless. They can also have behaviors such as loss of interest, no longer finding pleasure in favorite activities, feeling tired easily, thoughts of suicide, drinking excessively, using drugs, engaging in high-risk activities. They can also have sexual interests such as reduced sexual desire, lack of sexual performance. They can also have cognitive abilities such as inability to concentrate, difficulty completing tasks, delayed responses during conversation. They can also experience sleep patterns such as insomnia, restless sleep, excessive sleepiness, not sleeping through the night. They can also experience physical well-being such as fatigue, pains, headache, digestive problems. Okay, now on to the women. Women may experience symptoms related to their mood, such as irritability, emotional well-being, such as feeling sad or empty, anxious or hopeless, behaviors such as loss of interest in activities, withdrawing from social engagements, thoughts of suicide. They can also experience cognitive abilities, such as thinking or talking more slowly. They can also experience sleep patterns, such as difficulty sleeping through the night, waking early, sleeping too much. When my depression hit really bad, I was sleeping too much. And I was not sleeping through the night. So, sleep is what affects me the most. I have had loss of interest in activities and stuff, but sleeping's the most one. They can also do physical well-being, such as decreased energy, greater fatigue, changes in appetite, weight changes, aches, pains, headaches, increased cramps. For me, I was irritable. I was always feeling sad, empty, anxious, and hopeless. I did not have interest in activities. I did not want to go to social engagements. I have had thoughts of suicide. Like I had mentioned, I had the sleep was a big one for me. I did have decreased energy. I was fatigued. I did have a change in appetite. I dealt with aches, pains, headaches, and cramps. So, pretty much the whole list I have experienced. So, moving on to children. Children may experience moods such as irritability, anger, mood swings, crying. Um, Emotional well being, such as feeling of in- incompetence. Incompetence. There you go. Sorry. Uh, like them thinking I can't do anything right, or despair, crying, intense sadness. Behaviors such as getting into trouble at school or refusing to go to school, avoiding friends or siblings, thoughts of death or suicide. Cognitive abilities such as difficulty concentrating, decline in school performance, changes in grades. Sleep patterns such as difficulty sleeping or sleeping too much. Physical well being such as loss of energy, digestive problems, changes in appetite, weight loss or gain. Um, um, Also, the symptoms can extend beyond your mind. So, but if you have any questions about anything I have said thus far, you can comment below. About if you have any questions about, the sleeping and all that, you can comment below and I will answer them. Um, Now we're getting into depression causes. There are several possibility causes of depression. They can range from biological to circumstantial. Common causes include family history. You're at a higher risk for developing depression if you have a family history of depression or another mood disorder. As far as I know, I don't have anybody in my family that's had depression. Um, you could have early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Um, Brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. You can also medical conditions can also is a common cause. Certain conditions may put you at a higher risk, such as chronic illness, insomnia, chronic pain, or attention deficit hyperactive disorder, which is ADHD. I have insomnia. I also have stress-induced seizures and chronic migraine, so that could also be a trigger or a cause of mine. Drug use, a history of drug or alcohol misuse can affect your risk. Let's say about 21% of people who have a substance use problem also experience depression. In addition to these causes, other risk factors for depression include low self-esteem or being self-critical. If you criticize yourself all the time, it's going to make you depressed.
I can't believe I can't be at school because this is my favorite one. Art. I want to be at school for art.
Personal history of mental illness, certain medications, stressful events such as loss of a loved one, economic problems, or a divorce. Many factors can influence feelings of depression, as well as who develops the condition and who doesn't. The depression test. There isn't a single test to diagnose depression, but your healthcare provider can make a diagnosis based on symptoms and a physiological evaluation. In most causes, they'll ask a series of questions about your moods, appetite, sleep pattern, activity level, or thoughts. They will ask you when you go in and you tell your doctor you think you're depressed. They'll ask you about your mood. Do you always feel hopelessness and all that? They'll ask you about your appetite. Has your appetite increased or decreased? They'll ask you about your sleep pattern. If your sleep is normal, or if you're not sleeping, or if you're sleeping too much, that sort of thing. They'll ask you about your activity level. If you have the energy to do anything. They'll ask you about your thoughts. If you have suicidal thoughts, that's a big one. They always ask that. Because depression can be linked to other health problems, your healthcare provider. I'm sorry about that. My freaking kids do not want to listen at all today. It's driving me insane. Okay, because depression can be linked to other health problems, your healthcare provider may also conduct a physical examination and order blood work. Sometimes thyroid problems or a vitamin D deficiency can trigger symptoms of depression. As I mentioned before in my other videos, my wife deals with mental health issues. She also deals with depression and stuff. She does have a thyroid problem. She has no thyroid. She has to take medicine to actually keep her alive, basically, because she has no thyroid, and you have to have that thyroid hormone to survive. So yeah. The biggest one, don't ignore symptoms of depression. If your mood doesn't improve or get worse, seek medical help. Depression is a serious mental health illness with a potential for complications. Please, please, please don't ignore the symptoms. If you don't know who to turn to, if you have no one to turn to, if you need information on where to go or whatever, please email me. I will leave my email in the description below. Email me, comment on my video. If you need help, please let me know. Don't ignore the signs of depression, because it will get worse and worse and worse. And the complications of ignoring the symptoms of depression, if left untreated, complications can include weight gain or loss, physical pain, substance use problems, panic attacks, relationship problems, social isolation, thoughts of suicide, or self-harm. If you do not get treated for depression, it is a good possibility that you will harm yourself or somebody else. Please get help if you need it. Do not ignore the signs of depression. Please. There are different types of depression as well. Depression can be broken into categories depending on the severity of symptoms. Some people experience mild and temporary episodes, while others experience severe and ongoing depression episodes. There are two main types: major depressive disorder and persistent depression disorder. Major depression disorder is the more severity form of depression. It's characterized by persistent feelings of sadness, hopelessness, and worthlessness that don't go away on their own. In order to be diagnosed with clinical depression, you must experience 5 or more of the following symptoms over a 2-week period: feeling depressed most of the day, loss of interest in most regular activities, significant weight loss or gain, sleeping a lot or not being able to sleep, slowed thinking or movement, fatigue or low energy most days, feelings of worthlessness or guilt, loss of concentration or indecisiveness, recurring thoughts of death or suicide. There are different subtypes of major depression disorder with the American Psychiatric Association refers to as specific Sorry about that. Let's see if I can get this word out again. Specific. I can't pronounce it. I'm sorry.
Pacific.
This includes atypical features, anxious distress, mixed features, peripartum onset, during pregnancy or right after giving birth, seasonal patterns, melanic features. Okay. Persistent depression disorder. It's also known as PDD. Used to be called dysthema. I can't pronounce that word, I'm sorry. It's a milder but chronic form of depression. In order for the diagnosis to be made, symptoms must last for at least 2 years. PDD can affect your life more than major depression because it lasts for a longer period. It's common for people with PDD to lose interest in normal daily activities, feel hopeless, lack productivity, and have low self-esteem. Depression can be treated successfully, but it's important to stick to your treatment plan. If you make a treatment plan with a provider or whatever and you do not stick to it, it will not help you. You need to stick to it. And if you try to help yourself without going to a medical provider and you find you need to go, if you still go, still do what you're doing at home to self-help you, because it will help you even more to have both benefits of it. So now we're getting into treatment for depression. Living with depression can be difficult, but treatment can help improve your quality of life. Talk to your healthcare provider about possible options. The Healthline Find Care tool can provide options in your area if you don't already have a doctor. Sorry about that once again. As I was saying, the Healthline Find Care tool can provide options in your area if you don't already have a doctor. You may successfully manage symptoms with one form of treatment, or you may find that a combination of treatments work best. It's common to combine medical treatments and lifestyle therapies, including the following. Okay, now we're getting into medications that your healthcare provider may prescribe you. They may prescribe you antidepressants, anti-anxiety, and antipsychotic medications. Each type of medication that's used to treat depression has benefits and potential risks. Here's some of the therapies that they might also do as well. Psychotherapy. Speaking with a therapist can help you learn skills to cope with the negative feelings. You may also benefit from family or group therapy sessions. Group therapy sessions never helped for me, but like I said in the beginning of this video, everybody's different. Everybody goes through depression different. So group therapy might help you. It didn't help me, but it might help you. They also do light therapy. Exposure to doses of white light can help regulate your mood and improve symptoms of depression. Light therapy is commonly used in seasonal affective disorders, which is now called major depressive disorder with seasonal patterns. Alternative therapies. Ask your healthcare provider about acupuncture or meditation. Some herbal supplements are also used to treat depression, like St. John's wort, SAMI, and fish oil. Talk with your healthcare provider before taking a supplement or combining a supplement with your prescribed medication, because some supplements can react with certain medication. Some supplements may also worsen depression or reduce the effectiveness of medication. If you are on medication for depression and you want to try a supplement or you want to try anything like that out of the ordinary, ask your healthcare provider first, like it said, because it may cause your actual medication not to work, or it might cause a bad reaction with your medication. So please ask your healthcare first. Exercise. Aim for 30 minutes of physical activity 3 to 5 days a week. Exercise can increase your body's production of endorphins, which are hormones that improve your mood. So, exercise at least 30 minutes. If you can't do 30 minutes, start with like 15 or however long you can do it. Just start like that and ease your way up to 30. Um, so, avoid alcohol and drugs. Drinking or misusing drugs may make you feel better for a little bit, but in the long run, these substances can make depression and anxiety symptoms worse. If you use alcohol and drugs, you'll feel good as long as the effects there. As soon as the drug wears off or the alcohol wears off, you're going to feel crappy again. You're only going to get relief for a short period of time. So just avoid it altogether. Learn how to say no. Feeling overwhelmed can worsen anxiety and depression symptoms. Setting boundaries in your professional and personal life can help you feel better. If somebody wants to go somewhere and you don't feel like going, don't go. I know I say that and I make myself go, but if you don't feel like going and everything, just tell them no. There's no shame in telling people no. Like I've told a couple people, I'm dealing with depression and everything, and they're like, come on, come over, let's, get you out of the house, get you out of the depression or whatever. It's not that easy. You can't snap your fingers and hope depression's gonna magically go away. It's not possible. So, learn how to say no. Also, take care of yourself. You can also improve symptoms of depression by taking care of yourself. This includes getting plenty of sleep, eating a healthy diet, avoid negative people, and participating in enjoyable activities. Sometimes depression doesn't respond to medication. Your healthcare provider may recommend other treatment options, and if your symptoms don't improve. So yeah. Take care of yourself. Like, I used to go, and I know this sounds nasty, but I used to go weeks at a time without showering because I just didn't have the energy. Finally, there's days I force myself to take a shower because it does make me feel a little better. It makes me feel human. So, I do that. I was eating only like once a day. I do at least try to eat lunch and dinner. So, yeah. Natural treatment for depression. Traditional depression treatments use a combination of prescription medication and counseling, but there are also alternative and complementary treatments you can try. It's important to remember that many of these natural treatments have few studies showing their effects on depression, good or bad. Likewise, the U.S. Food and Drug Administration, the FDA, doesn't approve many of the dietary supplements on the market in the United States. So you want to make sure you're buying products from a trustworthy brand. Talk to your healthcare provider before adding supplements to your treatment plan. So, I've already talked about the supplements earlier, so I'm not going to talk about them again. If you want to look up the supplements, on your own, you can. But I'm not going over the supplements again because I just went over them on earlier in the video. So, but you can also try essential oils. Essential oils are a popular remedy to help depression. You can try the wild ginger. Inhaling this strong scent may activate serotonin receptors in your brain. This may slow the release of stress-inducing hormones. Um, Bergamot, I'm not sure if I said that right. This citrusy essential oil has been shown to reduce anxiety in patients awaiting surgery. The same benefit may help individuals who experience anxiety as a result of depression, but there's no research that support that claim. So, other oils such as chamomile and rose oil may have a calming effect when they're inhaled. Those oils may be beneficial during short-term use. There's also vitamins you can also try. You can try vitamin B. B12 and B6 are vital to brain health. When your vitamin B levels are low, your risk for developing depression may be higher. Every time they do my blood or do a panel on my blood is, I'm always B12. My B12's low. I'm supposed to be on a supplement for that. I do not take it. I think it makes me feel worse. I might start taking it again. I'm not sure to try it again. I'm not sure. But you can also do vitamin D, sometimes called the sunshine vitamin, because exposure to the sun supplies it to your body. Vitamin D is important for brain, heart, and bone health. People who are depressed are more likely to have low levels of this vitamin. They've never told me my vitamin D is low, so I don't know if that would benefit me, but it might benefit you. Everybody's different, as I've said before. Preventing depression. Depression isn't generally considered to be preventable. It's harder to recognize what causes it, which means preventing it is even more difficult. But once you've experienced a depressive episode, you may be better prepared to prevent a future episode by learning which lifestyle changes and treatments are helpful. Techniques that may help include regular exercise, getting plenty of sleep, maintaining treatment, reducing stress, building strong relationships with others. So yeah. But so yeah, that's pretty much depression. I'm not going into the depression with other mental health because I just wanted to focus on depression right now. But yeah, that's depression. Like I said, if you have any questions, if you just need support, if you just need somebody to talk to, I'll leave my email address in the description below. You can also comment at the bottom of this video if you need any advice, any help, anything. So yeah, I also want to throw in there for the essential oils also lavender. You could try lavender. Lavender is supposed to be soothing as well. There was another thing. Oh yeah, if you think you have depression but you haven't went to the doctor or whatever, it's something that my therapist had told me to do, and she asked me what stuff used to make me happy and everything. And to start off, you can start off doing what used to make you happy, what hobbies you used to have or whatever. I used to crochet all the time. I don't much anymore. But she told me to at least try to do it at least once a week, and then gradually move up to like twice a week or 3 times a week or whatever. So you can also try that. There was something else I was gonna tell you, and it like slipped my mind. But that's okay, because if I think about it or whatever, I'll just put it in the description. But yeah, so that is depression. I hope you all enjoyed the support talk with me. I'm Cecilia. Um, so please, if you need any help, need any advice, email me or comment below. Please like and subscribe to my channel for more videos on depression, more videos of my life, just more videos in general. I'll see you on the next one.